and stuff is this interaction. Yeah, there is a skill component, there is a knowledge component, but I can get a lot of I can go a long ways. I can get a lot of buy-in from my patients for what I have to do just by my ability to interact with them, project confidence, use appropriate language. So if I come to you and say, yeah, we're gonna try this infrared, and golly, you know, it seems kind of like voodoo to me, but you know, the PT told me we should try this, and somebody in school said something about it maybe working. You know, is your patient on board? And you know, we laugh now. I have heard that conversation go on in a therapy gym, and your patient, one, doesn't want to do it, is going to start complaining that you're charging them for nothing, doesn't want to take the time, may stop coming to treatment. It may be a valid tool, and not just this one, but lots of your tools that you use. So either use it or don't use it, but if you choose to use a modality, especially something that's a little bit more off the beaten path, like infrared might be, you need to decide if you're going to use it or not use it. You need to decide if you're going to do some research and read about it and see if it actually maybe works or if it doesn't work. We go back and forth all the time. Since I've gotten out of school, photophoresis was out, photophoresis was in, we got to change how we do it, we got to use this, it's out again. I mean, so you got to make decisions, understand why it's supposed to work, and then make a judgment or do some research, and then when you decide to use it, we don't lie to our patients. There's a big difference between, hey, I want to try some infrared stimulation. This is really kind of cool. It's got pads that produce infrared light in these LEDs, and then it's actually at a wavelength that will penetrate your skin. It will go through your skin, and it will affect the circulation underneath. It will affect the body's ability to repair itself and to release nitrous oxide, which is good for helping pain release, and can actually affect peripheral neuropathy and nerve growth. So there's a big difference between that and my first take on, here comes the voodoo pads. Okay, so infrared, a lot of times your patient's not going to feel it, they're not going to know, but there is some literature that tells us that this works in some cases. Peripheral neuropathy, there is plenty of research out there that tells us that this can help with a peripheral neuropathy, can actually, and they're not 100% sure why. The speculation is, you know, those nerves that feed that neuropathy need circulation. They need blood flow just like anything else in our body. Everything in our body needs nutrients, needs oxygen, needs waste products removed. So if you're not doing that, things start to die. So if you got little teeny tiny circulation going to nerves, and that what's going to go first is probably some of those little circulatory things. Maybe this is your best bet for that, okay?
Well, if it's called without pain, but you're actually wanting to help the nerves feel, so which means you would feel pain. Like, how's that?
Well, nerves do more things than just pain.
But how would it make it lessen pain? Okay, like for example, I have a brother-in-law with post-polio. He's in a lot of pain.
Right. Probably not
No,
the best choice.
no.
Yeah.
It's not going to make the pain go away.
Maybe a TENS or a medication.
I think it's done some electrical things.
So, like I said, it's not every case for everybody. The thing with infrared and Anodyne is that it can improve peripheral neuropathies. It can actually help improve peripheral neuropathy and improve sensation. But you lose the effects when you stop using it. So Medicare initially paid for it. I think they reimbursed like $2 a treatment. It cost me more than $2 to put this on you. Even if I'm just, not just, but even if I'm paying a technician to run the machine and do a lot of it, I'm obligated to come in, inspect the skin, look at it, check on them before and after the treatment. I need some saran wrap, I need some cleaning products, I need a technician, I need space. It's going to cost me. I'm going to lose money when I do this in the clinic most of the time. So it's usually done in conjunction with other things. But I have a friend who's a PT whose father has peripheral neuropathy. It helped him so much that he went and bought his own unit, and he uses it every day. He gets up, puts it on his legs, and drinks his coffee and reads his paper and does his treatment and feels that he's got significantly improved peripheral neuropathy. So where I see these used in the clinic sometimes is wound care and stuff. You'll see the pads placed at wound sites or to try to improve circulation, to try to help with the wound healing process. So, and sometimes it's done because you're not making a lot of money off this. Maybe you're in the acute care, maybe you're doing it after treatment. You know, it's like, let me just stick this on you. You just lay there, I'm gonna go do something else. It's not costing me a lot of money, but if it's gonna speed up their healing, it might help out. Okay, so when I do these pads,